Hey guys, it's Dr. Stern with Plastic Surgery, and I want to talk about the next most common question I have is why choose the different types of silicone implants? We have different levels of cohesivity, which is how cohesive the gel is, and that makes a difference in the properties of the gel. So we have responsive gel, which is the least cohesive. Then we have a soft touch gel, which is kind of in the middle. And we have the cohesive gel, which is the most cohesive implants on the market. Those are the true gummy bear implants. And when do we choose what for different patients? It's a really good question. And it's kind of up to the surgeon for the most part. But in general, the thinner the skin or the tissue on the patient, the more the implant is likely to show under the skin, the better properties of the implants you want. So what that means is for women who are very, very skin or have a lot of stretching after weight loss or pregnancy, you want to use the implant that has the least amount of rippling. And cohesive gel implants do that by being the most cohesive. You can see when you hold an implant up the way you're going to be sitting when you're standing or in a bathing suit or in a bikini, you do that, and you can see that this implant, because it's cohesive, it maintains the teardrop shape of the implant. It doesn't drop down all the way down. It maintains the fullness in the upper pole. You get this nice fullness and this nice with a cohesive implant. So this is a cohesive implant, and I use it most often for women who are very, very thin, have lost a lot of loss of tissue after weight loss or pregnancy, and women who really want a lot of upper pole fullness after an augmentation. For most women, a responsive gel implant, which is called the responsive gummy bears, you can see the top doesn't hold as much. That's not a factor in most women because the muscle is covering the implant and they have plenty of breast tissue, and so we're just using something for volume. And so for most women, this is a great implant. It does ripple more in the upper position, but in the downward position when patients are laying down, it has a nice dome. It's still very, very soft and cohesive. It has a nice level of cohesivity. It just doesn't maintain the upper level support as much as the cohesive gel implant does. So again, not good for patients with reconstruction who have no soft tissue because the breasts are removed after mastectomy. It's not good for very, very thin patients, but it's great for most patients that we see to give them volume and symmetry and give a really nice soft breast with good enhancement. So silicone implants, remember, lifetime warranty. If anything happens to the implant, if they rupture or leak anytime in your life, they're replaced. The implants are given to you for free by the company for the first 10 years. The company pays for any defects. They pay for the surgery and the anesthesia to replace those defects. And then obviously the most common question is silicone safe? It's 100% safe. It's been tested multiple times over thousands of different studies and different women. There is no increase in autoimmune disorders, any type of problematic issues inside the breast when silicone implants are used, and that's been proven over and over again. So very, very safe implants. Because they're gel, they're even safer now than they used to be when they were liquid, because if I was to cut this implant in half, it would just sit right there. It doesn't leak into the body or anything like that. So extremely safe implants, and they're very good for long-term placement, so you don't have to monitor them or get them replaced unless there's ever a problem in the future. These are also smooth surface silicone implants. Most implants I use are smooth surface implants, and we put most of them underneath the muscle. There are textured implants, which have a little bit more problems of their own, and we can discuss that later, but I tend to use less textured implants and more silicone smooth implants. So that's the difference between the different levels of cohesivity in our cohesive gel implants. And if you have any more questions, just write down below and I'll answer you offline. So I hope you enjoyed this segment of learning about silicone implants. I'm Dr. Sternberg with Plastic Surgery. Have a good day, everybody.